The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, how are you doing? Hope you all are doing great today. This is a special Lunch and Learn today. Usually we do them on Thursday, but if you were with us last week, we experienced some technical difficulties. So we definitely apologize for any inconvenience that we may have caused, but we're hoping to help you guys today talk a little bit about some of the comments you can provide to the Department of Health and Human Services on the proposed Child Care and Development Fund rules. My name is Nick Fusick, and I take care of government affairs here at Child Care Aware of America. If you have any questions throughout the entire webinar, there's a question box you'll see on your screen. If you just type them into there, I'll leave some time towards the end of the Lunch and Learn that we'll be able to talk a little bit about any questions or comments you had. So starting off, what is the proposed rule from the Department of Health and Human Services? It was released in May of 2013, in mid-May. It is part of the administration's plan for early education. It includes the President's plan for early education includes pieces like home visiting, early Head Start and child care partnerships, and one of the bigger pieces is the Preschool for All initiative. So this is part of that. The full proposed rule is available at this link below. These slides will be provided online where you found the link to the webinar. And lastly, there's a 75-day public comment period which ends August 5th, 2013, which is this upcoming Monday. So if you have comments, please get them to HHS within the next week. So what are some of the highlights of the proposed rule? Some of the highlights of the proposed rule include requiring providers to undergo comprehensive background checks, including federal and state fingerprints. It requires minimum training, including safe sleep practices, first aid, practices to prevent shaken baby syndrome, and emergency evacuation or shelter-in-place planning, planning for disaster and emergency responses in child care settings, raising the eligibility period for 12 months, helping to ensure continuity of care for children and families, and lastly, enhanced resources to assist families in finding quality child care in their area, including a consumer education website with comparable quality indicators, a consumer complaint hotline, and better coordination with other services impacting families and children. So this is just a summary of what was included. The actual proposed rule was roughly 200 pages. And it went down into a lot of more in-depth detail. So if there's something that interests you that we haven't talked about in one of the previous webinars, feel free to go see the full rule, read through it. And if there's a specific piece, say background checks, inspections, training, consumer education, we've covered those in previous webinars, which can be accessed via our policy webinar Lunch and Learn page from our website. So before we get into kind of the topic of today's webinar, let's talk a little bit about the federal rulemaking process. This is one of the more complex and intriguing parts of government. So what happens is a federal agency looks to see if there's a need that can be met through the regulatory process, and if determined as necessary, a rule is drafted. After they draft a rule, the federal agency then publishes the new rule to the Federal Register. Once the rule is published, the public is then able to comment on the rule for a set period of time, typically ranging from 30 days to 90 days. And as I mentioned before, this one had a 75-day comment period. Once the comment period ends, the federal agency then reviews the comments and revises the rules where necessary. After that, the federal agency republishes the revised final rule in the Federal Register. Next, the federal agency then submits the final rule to Congress and the Government Accountability Office for review, which could take up to 60 days. And lastly, the federal agency then implements the final rule. So where are we in this process? The rule is open for public comments, and the public comments are currently being submitted. There are currently 125 comments that HHS has received from all walks of the field, people from nutrition to resource and referral agencies to parents to providers to county and government, state government officials have all put in their input so far. So we really would like to see as much varying input put in there so that the Department of Health and Human Services is well informed when looking to revise the rule if necessary. What will happen next is they'll take the comments, they'll review them, and they'll revise if there's a specific area of the rule that's especially troublesome or received a lot of comments. They'll look to see where they can fix that. And a lot of the comments they'll take and look at for implementation when they're actually looking to put this into the works, which are the best ways to take care of stuff. So if there's something your agency, your state, you as a provider do that is specifically has worked very well for you, that's something great to talk to the Department of Health and Human Services about, which I'll get into a little bit more as we move forward. So let's talk a little bit about the commenting process. This is something relatively new from the government. Regulations.gov is a newer system to provide comments. So you would go to the link provided above here, and once again, these slides will be provided online to make it easy access for all these links. But if you want to find it without the link, all you need to do is go to regulations.gov and search CCBS, and it should be the first link that appears. So what happens is you'll get a little box like this, and you'll be able to click Comment Now. As I mentioned, comments must be submitted by August 5th, 2013. And once you hit Comment Now, you'll see it will take you to a screen like this. What you'll be able to do in the screen is it's pretty straightforward. You'll be able to provide your name, your organization, a paragraph of a comment, or if you're submitting a attachment, you can always reference the attached files. And under Section 3, which you'll see here, you can have the ability to upload a file. So if your comments are more than the characters allotted for, you're allowed to submit a document, a PDF, where you can go more into depth. So if you want to look, Child Care Aware of America submitted their comments on the 19th of July. Our comments are now provided there, so if you would like that, they're there for your reference. And once you upload your file, you can hit submit. What typically happens from there is it takes typically a day or two for regulations.gov to make sure you're not submitting inappropriate content or irrelevant content. And once they do that, your comments will then be submitted publicly. So let's talk about what to submit. Child Care Aware America has provided some sample comments to help guide you along your ways when you're looking at commenting. There's two types of comments that we have provided. These can both be found on our website. If you go to our core policy issue page, this is under the HHS proposed rule section, and you can see it says sample comments. So there's two types of comments that you'll see. One is a more general comment, typically saying, oh, we support quality improvements in child care, and we think this is a great step forward for keeping children safe. We strongly believe that all families should have access to quality and affordable child care. It's an important factor in economic development, but this allows you to make your voice heard without having to go into the in-depth type of comment that you'll see from some organizations. Additionally, the second type of comment is a more formal comment letter. You will see approximately 20% of the submissions follow this format. If you have specific areas where you feel your expertise or knowledge or practice experience would lend credence to helping them implement or revise a certain section of the proposed rule, you can come into here and see we've broken it down into example sections of how to comment on the proposed rule. So, for example, in this sample comments, we broke it down into health and safety requirements, minimum health and safety requirements, and monitoring requirements. So if you look, these are just examples of what you could submit. There's greater examples on the website, so you can go to the website and see these and read over them and borrow from them if you want, or just use them as a guideline for moving forward with them. So now that we've talked about, a little bit about samples, let's talk about what Child Care Aware of America submitted. If you would like to see a direct link to our comments, it is provided here. And like I said, once again, just reminding that these slides will be made available online afterwards. Our comments were generally supportive. As an organization, we are very supportive of any initiatives to improve the quality and safety of child care that promotes the healthy development of children. We believe this would be a great step forward towards moving towards raising the bar and quality settings across the country. So part of what we did, we provided clarification around 5 main areas in our comments. Those areas were health and safety, workforce training, consumer education, affordability and accessibility, and cost of implementation. So in our opinion, these were the 5 largest hot topics that we felt we could provide some clarification on based on our experience in the field. So what we talked about a lot were areas, for example, in health and safety, talking about one of the things the Department of Health and Human Services specifically asked for comments on were around whether or not people 18 years of age or older living in a child care home should be required to get a background check. So just an example of our response to that was that 43 states already provide or require those 18 years of age or older living in a family child care home to undergo a comprehensive background check. So requiring the other 8 states plus DC, the 51 total, would not be a massive lift for this and wouldn't be a significant cost driver. And for example, we've talked in workforce training, one of our policy recommendations is for setting a minimum training hours. So we usually recommend 40 hours of initial training and 24 hours of annual training based on research that we have relied on in the past. So, for example, in that was something else that the Department of Health and Human Services asked for comment on. So when you're going through the proposed rule or any of our previous webinars or any of our materials on the website, feel free to look through it. If you see something that is particularly interesting to you, where you feel like you or your organization really can lend some, lend some insight into it. That's what the Department of Health and Human Services is looking for. And, if there's a question while you're doing that, we're happy. Feel free to reach out to us. I can talk more about that later. But if there's something that doesn't catch your eye and you're supportive of the comments, you can feel free to put in a in-depth comment supporting all of it as well. I mean, the important thing is you're making your voice heard by the Department of Health and Human Services. And I don't think that can be underestimated in this process, is how important that is. So just for your reference, we've provided some resources here. So the the Administration for Children and Families provided a general landing page where you can find all of their resources. The regulations and to comment can be found at the next link. You can find our sample comments, the ones that I showed on the page before, at this link. And lastly, you can find frequently asked questions on the proposed rule for the Child Care and Development Fund at this last link. So at this point, I'm going to open it up for questions, comments, concerns, assistance. If there's anything that would be of particular interest to you to know prior to making your comment, or if there's something that you feel we could be helpful with, please let us know. We're here to make sure you guys are getting your input out there. I mean, that's what's really important here. So I'm going to open it up for questions at this time. If you have them, please put them in this the box on your screen. Looks like we have a couple already, so I'm going to read through them. So this is a great question. I had mentioned that we had submitted comments from Child Care Aware of America. If you go to the question, sorry. We had submitted comments from Child Care Aware of America. We had submitted them to the regulations.gov website. So if you go to that website, you can look for comments from Lynette Fraga, our Executive Director, on behalf of the organization, Child Care Aware of America, and you can download the PDF. All comments submitted are public record, so anybody who has submitted a comment up until this point and anybody submitting a comment from here on out, the public will have access to those comments. So if you'd like to see the comments we submitted, you can go to regulations.gov, search the Child Care and Development Fund, CCDF is fine, and just browse through the comments. There's 125 comments, so it shouldn't be that difficult to find. And if you want to search by date, our comments were submitted on July 19th, so 7/19/2013. This is another good one. As I said, these slides will be available on the website, our Lunch and Learn website under policy from our usa.childcareaware.org website. So if you have any questions on that, please feel free to let us know. We're here to help. Oh, another good one, just another clarification. When does the comment period end? The comment period ends August 5th. That is this upcoming Monday. So you approximately have, I want to say 5 days to submit your comment. So in these 5 days, I know a lot of people have been working on them. If you run into a roadblock, an obstacle, something that catches your eye that you need some help with, I've included my email address on this slide. It's just nick.vusic@usa.childcareaware.org. I am happy to help with any questions you have, technical assistance. If you're writing through this and even want to ask, something simple like, is this a good phrase to use? Should I talk about this area? Is this worth going into? It's something that, we're here to answer any questions for you guys to help make sure you're, you guys feel comfortable submitting your questions and comments moving forward. I mean, that's what this is, like I said before, that's what this is really about. Oh, this is another great question, and very important, and one we get quite a bit. What's the timeline moving moving forward after the public comment period ends? So with the public comment period ending on Monday, one of the things that will happen is, depending on the number of comments, the Department of Health and Human Services will take into consideration all of the comments. So say if there's hundreds of comments, what you'll see is a lot of time taken to review the comments. It depends on how many comments there are, is how long it will take them to review. And what that would do is, if they only have a few, if they only have a couple hundred comments, the review period shouldn't take that long, and the assumption is that there wouldn't need to be that many revisions. So they'd be able to move forward sooner rather than later. But as far as specific timeline, it's difficult to gauge just as a result of we don't have a specific number of comments yet. Let's see if we have any more questions. Are these for providers who receive CCDF funds only, or are they for all providers? I asked because it states that it would add requirements for child care providers serving children receiving CCDF assistance. This is a great question, and definitely something that is helpful to clarify. This would only be for providers receiving funds through CCDF. But since many providers who receive CCDF funds also serve children who do not receive CCDF funds, it would affect a wide number of children across the country. At the same time, many of the improvements and enhancements and initiatives would impact all children and families. For example, a consumer education website would be available to all families, not just those receiving child care assistance through the CCDF. So this would be a little interesting to see, because we're not sure how much this would impact yet, but we know it would have a larger impact because, like I said, many providers serve both CCDF-funded children and families and non-subsidy children. Let's see. Are the annual screenings they're talking about from licensing someone else? If so, who? The annual screening. So let me talk a little bit about this. One of the pieces of this is inspections annually. So there's two types of inspections they are looking at requiring. One is a pre-licensure inspection. So before becoming licensed, child care providers would have to be inspected. And then another one is an annual screening piece. So at least once a year, providers would be required to receive an unannounced inspection. These would be from the department who license in your state. So many states already have departments who handle licensing. Some states have that frequently changing, so it's hard to tell specifically on a state-by-state basis, but whoever handles the licensing for your state would be handling the inspections at the same time. All right, let's see if there's any more questions. And that looks like it. So throughout the next 5 days or so, if you're working on your comments and have any questions, or have any comments or questions generally, policy-related regarding the proposed rule, we'll be happy to answer them. You have my email. We'll be providing the slides. And we appreciate your participation in today's webinar. And we hope it was enjoyable. And we hope you have a good week. Thank you very much.